Day is almost over. It's getting late. The sun, I think, has set. The snow has pushed us, so we did 3 cases today. First case was a very interesting case. Patient was completely edentulous, but he had too much bone. And that means that his bone was showing when he smiles. And a lot of dental offices, and especially implant centers, make a lot of mistakes where they just take people's teeth out and place the implants in, and then you see they look like they have horse teeth. So in my first patient, we were able to recontour the bone, placed a bunch of really strong implants, and get him a brand new smile. That was done pretty easy. The challenge in that case was to study the patient's smile and make sure that the teeth are custom to where they are. And why is that important? Because if you go to the dentist and the person that's doing the surgery is not the person putting the teeth in, problems can happen, and then although your implants may not fail, they may not be in the right position. Case number 2. Case number 2 is a very interesting case, but medically compromised patient and very minimal bone. In this case, we really wanted to avoid going into the zygoma for her because she had very thin zygomas. So we really had no choice to make sure that we hit it right on the target, and we had no second chances. So in this case, we decided to use a robotically guided surgery called Navident, where we were able to place 2 pterygoid implants all the way in the back into the pterygoid bone. And then right in the front of the sinus, we were able to do an angled case to really hug the sinus. At the same time, we crushed the sinus to bring it up and do a sinus lift for the future. And then right behind that crush, we were able to do another sinus lift with an immediate implant placement. All in all, the patient had the case immediately loaded with a ton of torque, and she did really well. And now to our final case of the day. This is a case where the patient had some implants that were placed, yet were never restored, had periodontal disease, a tremendous amount of recession, teeth that had splayed out, weren't the way that she wanted in terms of her smile, diastema that she never really wanted. We're able to do a almost flapless surgery to the point where we decided to do a case where the patient will not have any pink tissue. Because of the way that everything was set up, we were able to do what's called the FP1 restoration. Not really, FP 1.5, but essentially where we didn't cut any bone, we didn't lift any flap in the positions where we didn't have to. We saved 2 of her implants, and we restored the upper with an FP1, FP 1.5 restoration, which is, for those of you that are patients and watching, that's teeth without any pink. It's not you that chooses, but if it's possible to happen, your dentist should make it happen. All of the implants were recorded with a shining intraoral scanner, and to double check to make sure that everything is perfect, we then used photogrammetry to overlay it, and we did all of the designs. We printed with the DentaFab printer. My assistants colored the teeth, and we delivered everything with Powerball 1.0, which is what we use for temporaries. All in all, it's a long day, lots of lives changed. Had an amazing anesthesiologist, amazing team that worked with us, and tomorrow's another day.